More than 50 Kaiser mental health workers across the islands are headed back to the office this morning. Today marking the official end to the country's longest mental health strike in history. KTV4's Aaron Coogan takes us to the Honolulu clinic and shares what this means for clinicians heading back to work.
Yeah, hey, Cynthia. Well, the first contract agreement since the union became a union in 2018. It's the reason I'm joined by Andrea Kimura this morning. Thank you so much for joining me along this whole 6-month journey. You know, we kind of came to a conclusion, but you're saying this is just the beginning for a much longer journey.
Yes, this is just the beginning. There still is a lot of work to be done in terms of like increasing the staffing. Our patients, their care hasn't changed any, over the course of the strike. We're actually down staff now. And so, we're fighting while we're at work now to, increase the number of staff, because we don't want the people of Hawaii to wait another 2 to 3 months, to establish their care like they have in the past.
Obviously, the salary increase, the wage increases over time, that's going to help attract some of those new workers. But is there anything else specifically in the contract that is saying, hey, we need these workers to support our already existing staff?
Yes, we were able to retain the pensions for new hires because we believe that that is an essential tool to attracting new providers to come and work for Kaiser. Unfortunately, Kaiser did do away with another part of the retirement benefits and take away from medical benefits for retirees. But we are very, very happy that we were able to keep the pension for new hires because that's such a valuable hiring tool, we believe.
Obviously, you guys on the front lines of the bargaining, of the negotiations, it has to go through you guys, and then it has to go through ratification by the whole union. What are people going back satisfied this morning?
I think there's mixed emotions about going back. Obviously everybody's happy, to go back and see their patients. We love our patients, we like caring for them, but we also want to care for them in the way that they should be cared for. Some of the economic things, for our members, they're not ideal because we are still getting paid less than what Kaiser settled back in October with California. And so, here we see, Hawaii being treated as second-class citizens because, they don't want to pay us, what they're paying people in California, therapists in California. And they're also not staffing at the same levels in Hawaii that they are in California. There's a lot of work to be done, obviously, in terms of, reestablishing the care for our patients, but also, like I said, we really want to push Kaiser to increase their staffing, and increase their staffing in the clinics, where we're at, because these are going to be people who are local, patients can actually see, they can see them face to face versus, okay, here I'm going to be on an app and I'm going to be seeing somebody who may be in California or someplace else that's not local.
Well, members of the National Union for Healthcare Workers getting back to business this morning. For now, I will send things back to Cynthia.